shocking, but it is true that all men are at risk of getting prostate cancer. The reason, according to an associate professor and medical expert, Dr. Chidi Oyu Esike, is simply because prostate cancer occurs only in males and all males have prostate. But he explained, and I quote, "It is, however, not every male that will have prostate cancer. Very unfortunately, we do not know who in particular among the male folks that will get it. So every person who is a man, especially those that are of the black race and over 40 years of age, are at risk of getting prostate cancer and should regularly check for it." On the male organ of the body called prostate, the medical expert explained in an article, the prostate is a gland of the male reproductive system that is found only in males. It produces parts of the fluid that makes up the semen that is ejaculated during sex. It is the size of a walnut fruit, with the normal size measuring about 4 cm wide, 3 cm long, and 2 cm when measured from the front to the back. The prostate gland is located just between the urinary bladder, the sac-like structure where urine from the body collects before it is passed out when we go to urinate. In front of the rectum, the lower part of our intestines or guts where feces is stored before we pass it out during defecation. Behind. It is partly surrounding the urethra, the tiny tube that passes from the urinary bladder through the penis through which we urinate. The prostate gland may grow bigger as men get older, or may in fact grow so big that it may make the passing of urine difficult, or may at times block the passage of urine completely, in which case one will need the help of doctors passing a small caliber rubber or metallic pipe called urinary catheter to enable the person pass urine. Continuing, he said, the prostate gland normally produces a substance called prostate-specific antigen, PSA for short. The production of this PSA increases when there is inflammation of the prostate gland, when there is enlargement of the prostate that is not due to cancer, called benign prostatic hyperplasia in medicine, and when prostate cancer occurs. Therefore, simply taking a little blood from the patient, say from a blood vessel in the forearm, can help suspect or have an idea of what is happening in the prostate, including the occurrence of prostate cancer. Cancer, according to Dr. Esike, occurs when cells of a specific part of the body grow and multiply rapidly and uncontrollably to produce abnormal new cells which have the ability to invade surrounding healthy tissues and organs, or to distant tissues and organs, causing diseases. On prostate cancer, he explained as follows. Prostate cancer occurs when the cells of the prostate gland grow and multiply abnormally to produce abnormal prostate gland cells that can initially invade the surrounding healthy prostate gland tissue, and if not discovered early, will invade distant tissues and organs. Prostate cancer occurs only in males and it is common and deadly. In fact, in Nigeria, it is the commonest and deadliest male cancer occurring in about every 33 of 100,000 Nigerian men, with 16 of them dying. Most of these men die after prolonged illness, pain, suffering, hospitalization, with a lot of money spent, and patients, relations, and loved ones going through a lot of avoidable agony and devastation. On risk factors for prostate cancer and how to reduce them, the associate professor had this to say. The risk of having prostate cancer is more in black men. This risk increases with increasing age, especially from the age of 40 years, and in males whose male relations such as fathers, uncles, etc. had suffered or are suffering from prostate cancer. Though it may not be possible to prevent the occurrence of prostate cancer, the risk of one getting it can be reduced, and this is the reason for writing this paper, so that our men can know and avail themselves of medical checkups, especially from 40 years of age, that can help them reduce the risk of getting prostate cancer or discovering it early when cure is possible. our female folks should encourage the men to go for the screening for prostate cancer as the males should do to the women for cervical and other cancers. Generally, the risk of getting prostate cancer can be reduced by stopping or quitting smoking, maintaining healthy lifestyles such as avoiding obesity, avoiding too much weight, reducing our body weight if we are obese, maintaining ideal body weight for our height, exercising regularly, avoiding sedentary lifestyle, keeping physical active, eating healthy diets with whole grains, lots of fruits and vegetables, and avoiding excess sugar, fats, sweetened and processed food, etc. The most specific way of reducing the risk of getting prostate cancer is by screening for it. Screening for disease, by the way, is looking for the disease when it has not started and before it starts manifesting its symptoms. This is important because by the time diseases, especially cancers, start manifesting their symptoms, they would have established themselves and may have invaded surrounding tissues or other more distant tissues, thus making cure difficult or impossible. The risk of getting prostate cancer can be reduced by screening for it. To do this, one goes to his doctor who will screen for prostate cancer by first asking the person some relevant questions, examining the person physically, including performing a rectal examination and sending him for prostate-specific antigen (PSA) test. One may go for the PSA test alone though. To do the rectal examination, the doctor will ask the person to lie down on the examination bed or couch and will position the person in a particular position with the patient facing away from the doctor. After telling the person what he wants to do, he, the doctor, will gently insert a gloved lubricated finger into the anus of the person and check how the prostate is. There are things he will feel and he will suspect some abnormalities in the prostate, including suspecting prostate cancer. Having performed the rectal examination to assess the prostate, the doctor will continue his screening for prostate cancer by sending the person for prostate-specific antigen (PSA) test. Prostate-specific antigen is a substance normally produced by the prostate, so there is a normal value of it in the blood. However, the quantity of PSA in the blood is increased when there is prostate cancer. PSA level in the blood also increases when there is inflammation of the prostate or when there is enlargement of the prostate that is not due to cancer, called benign prostatic hyperplasia in medicine. So it is not every increase in the quantity of PSA that is due to prostate cancer, but your doctor, if he or she is not a urologist, will likely send you to a specialist doctor in this area called a urologist, who will be able to know if the increase in your PSA is due to cancer of the prostate or not. If the PSA value in the blood is increased, one may be sent for further tests like ultrasound, magnetic resonance imaging, MRI, CT scan, etc. to know the exact cause of the high PSA. The person may also be taken to the operating theater and bits of any suspicious looking parts of the prostate called a biopsy are taken and sent for a special test called histology. When these pieces of prostate tissues are analyzed, it will be shown if it is prostate cancer that the person has or not, and the person will be treated accordingly. If after the examination the prostate feels normal and the PSA level is within normal limits, that means that the person most likely does not have prostate cancer. It is usually a good practice to carry out medical checkups, including checking for prostate cancer at regular intervals of, say, yearly. This is because with the whole lot of activities going on in the body, at the cellular level, a new prostate cancer may develop within the interval of the test. Again, there is the small chance that an early onset prostate cancer may be missed for some reasons in the previous testing. This will most likely be discovered in subsequent testing. Prostate cancer, though a disease that can kill after causing prolonged and severe agony to affected men, can be completely cured if discovered early or the risk of occurrence reduced by simple and relatively inexpensive medical checkups. Avoid procrastination. Go for a medical checkup now. From Lagos, this is Peace Nwabuko, News Express Nigerian Television.